Before you clock out for the last time, there are 3 critical actions to take to protect your health, secure your healthcare coverage, and squeeze every last drop out of the benefits you've earned at work. This isn't just preparation, it's about timing and maximizing your retirement strategies while minimizing your stress. As you approach retirement, certain changes sneak up, and understanding them now helps you to plan how to maintain independence, energy, and quality of life. Action 1. Get a comprehensive health checkup before you retire. This entails scheduling a full physical exam with your primary care physician, reviewing your medical health history and chronic conditions, along with discussing your plan for any treatments, vaccinations, and medications. As we age, infections can hit harder and recovery time takes longer. You'll want to get a baseline of your vital signs, blood pressure, heart rate, and BMI. Blood vessels stiffen, making blood pressure harder to control as we mature, and heart recovery after exertion takes longer. Be sure to include blood work. Base labs would include a comprehensive metabolic panel to check liver, kidney, and electrolytes, a lipid panel for cholesterol and triglycerides. Age-related shifts in lipid metabolism raise cardiovascular risk, even in people with a healthy lifestyle. This is one you'll want to track regularly. Blood glucose or A1C for diabetes screening, even if you're not a diabetic. And if you are, be sure you have your A1C included, not just a glucose test. And blood work should be repeated every 3 months or when medication is changed. You'll also want to have a complete blood count, a CBC, as part of your script to screen for anemia or infection. Thyroid function tests are important to detect any undiagnosed issues. Thyroid health impacts energy, mood, and cognitive function. Thyroid hormones regulate your heart rate, cholesterol levels, and weight. An underactive thyroid can cause high cholesterol, weight gain, and slow metabolism. As we age, symptoms like fatigue, depression, memory issues, or brain fog can be mistaken for normal aging, but could actually be signs of hypothyroidism, underactive thyroid. Hyperthyroidism, overactive, can cause anxiety, irritability, sleep problems, and heart palpitations, all of which can severely affect your quality of life. This can also lead to irregular heartbeat, known as AFib, and bone loss. Blood work should also include vitamin D and B12 levels. This is especially important as we age, and if you're a diabetic taking metformin. Metformin can interfere with B12 absorption, possibly leading to a deficiency. And if there are any other labs that you do outside of these, be sure to include those. You'll want to have a cardiovascular screening done. This would include a stress test or echocardiogram if you have risk factors or symptoms. Chronic low-grade inflammation increases risk for heart disease, Alzheimer's, and other age-related illnesses. If you already have a cardiologist, be sure to schedule an appointment for any tests that may be needed or overdue. It's a good idea to be screened for certain cancers, age and risk-based, starting with a colonoscopy. This usually begins around ages 45 to 50 and then every 10 years or is recommended. Mammograms for women typically start between the ages of 40 to 50 and then annually thereafter. And for men, a prostate screening should be scheduled, known as a PSA test. And don't forget about your skin. It's a wise idea to schedule an exam with a dermatologist to check for suspicious moles or lesions. Also consider a hearing test, as a decrease or loss can impact your independence and safety. This is especially important if you notice any changes or have a history of noise exposure. Bone health should not be overlooked. As we grow older, osteoporosis is a concern for both women and men. As you head into retirement, physical changes can affect your daily living, such as muscle loss, because we naturally lose muscle and strength starting in our 40s, which increases after 60. Less muscle means lower metabolism, slower recovery from illness, and higher fall risk. Bone density declines, especially in postmenopausal women, increasing your risk for fractures. Arthritis or stiffness may limit mobility and affect travel, hobbies, or home tasks. A bone density scan, known as DEXA, is important if you are at risk for osteoporosis. This is usually done for women around 65 or older and men 70 plus. This is why strength training is vital to your future health and maintaining your bone and muscle mass. As a side note, if you're prescribed calcium, I would caution you on taking more than 400 to 600 milligrams in a single dose because this is all your body can absorb. Also, do not take calcium if you take an iron supplement at the same time. Neither one will be absorbed. Balance and coordination is another physical change that happens. The vestibular system, the sensory system in your inner ear, and reflexes slow down, making falls more likely. There are specific tests for balance and coordination. Ask your doctor for a fall risk assessment as part of your health checkup, especially if you've had or have dizziness or vertigo, a recent fall, difficulty walking or standing for long periods of time, vision changes, neuropathy, or diabetes. Think about having a mental health screening if you feel it's warranted. Depression and anxiety can be screened. A cognitive function assessment can be performed if you're concerned about memory or mental sharpness. If you notice a slower recall or challenges with your daily tasks, don't chalk it up to old age. Dementia typically begins gradually, and its onset and progression vary depending on the type. It most commonly starts to appear in people over the age of 65, but early onset can begin as early in your 40s and 50s. You'll also want to review all current medications and supplements with your doctor. Don't forget to tell your doctor what supplements you're taking and why, as these can interfere with medications. Plan for prescription refills, and discuss long-term medication needs. Lifestyle assessment and counseling should be considered if you're a smoker and looking to quit. Ask your doctor about your options. The same goes for alcohol. Also, ask your doctor for a script to see a dietitian if you're looking to lose some weight or taking medications that may interfere with certain foods like blood thinners, and vitamin K. A dietitian can help you with an individualized health plan for your specific needs. You'll want to keep all your records, whether you handwrite them or make a Word or Excel spreadsheet. And it's worth mentioning to always keep a list of medications with you along with their doses. Each time you go see a doctor, you'll have that information readily available. And your health maintenance plan should include future follow-ups and any screenings. Discuss any signs or symptoms that are new since the last time you had a checkup. Why does this action matter? Retirement often means less frequent contact with a primary doctor. So, leaving with a full view of your health ensures you can catch or manage issues early. It also sets a foundation to plan future care and insurance needs, which brings me to action number 2. Map out your health insurance timeline now. Between 62, when you might start thinking about collecting Social Security, and 65, when Medicare kicks in, healthcare coverage is one of the biggest expenses and decision points you'll face. If you don't plan for it, the gap can eat into your savings. Don't wait until the last day at work to find out exactly when your employer health coverage ends and when your Medicare or other health insurance. You'll want to avoid any gaps that could leave you uninsured or paying out of pocket unexpectedly. Confirm your employer's coverage end date. It might be the last day, end of the month, or end of quarter. Check Medicare eligibility if you qualify, but you'll need to apply 3 months in advance. If you retire before Medicare eligibility, explore COBRA or private health insurance options. Know your insurance options available to you before you leave your job. These may include Medicare if you're 65 or older with understanding parts A, B, C, Advantage, and D, drug plan, and decide which plan fits your needs. I'm not a pro on Medicare. However, you can start with the official website at medicare.gov. You can also contact your state health insurance assistance program known as SHIP. They offer free personalized counseling about Medicare. You can find your local SHIP office through the website medicare.gov. Another option may be COBRA, which allows you to keep your employer plan temporarily. This is usually about 18 months, but can be expensive since you'll pay full premiums, if that's an option at your place of employment. If you retire before Medicare age, you can buy a plan on the ACA marketplace, possibly with partial financial support. Contact the website at healthcare.gov, or some states run their own marketplaces separate from healthcare.gov. Check if your state has its own site by visiting the healthcare.gov website. And finally, if you have a spouse still working, check if you're eligible for your spouse's employer coverage. Review your current prescriptions and how they're covered under any new plans. Schedule any necessary treatments or procedures before your employer coverage ends to avoid delays or higher costs. For example, if you need a knee or hip replacement and you've been putting it off, now might be a good time before you retire to consider it. Talk to your doctor about a plan while you're still covered. Why does this action matter? The transition period can be risky, missing deadlines, or a stressful rush for insurance. Planning carefully ensures seamless care without surprises. And action number 3, maximize your employer benefits before you hand in your badge. Many pre-retirees leave money and benefits on the table simply because they didn't check the fine print or the timing of the benefits before they leave. Review your wellness program incentives, any unused sick leave that can be applied toward health coverage, and opportunities to schedule preventive care visits while you're still insured. If you have access to a health savings account, HSA, contribute as much as possible before you leave, especially if your employer matches contributions, because those dollars grow tax-free and can be used for medical expenses in retirement. Find out when your employer contributes to the plan. It may be quarterly. And if you have the opportunity to select another plan with HSA as an option, even if it's for another year and you're still working and you're not quite there yet, seriously consider it and start contributing. It's worth contributing due to the tax advantages I mentioned earlier. And before you leave, it's essential to review your rollover and transfer options, such as leaving your money in your current employer's plan or transferring somewhere else. Additionally, verify the payout schedule for any remaining bonuses, profit sharing, or employer deposits to retirement accounts so you don't miss out due to an oversight in your timing of your exit. A little planning can mean hundreds or even thousands of dollars in your pocket when you walk out the door. To recap, action 1. Before retiring, schedule thorough medical, dental, skin, and vision exams to establish a clear baseline for your health. Address any ongoing issues or preventative screenings now so you start retirement with a clean bill of health or at least a solid healthcare plan. Action 2. Review how your health insurance will change once you leave your job, from employer to insurance to Medicare or private plans. Coordinate the timing to avoid gaps in coverage and ensure you know what services and prescriptions will be covered. And action 3, use any remaining healthcare related benefits tied to your job, such as wellness program bonuses, unused sick leave or vacation time, and your HSA and 401k if you have one. Also, confirm the timing of any last bonuses or employer deposits to optimize your retirement benefits. Some employers offer free counseling with a financial advisor to help you decide your best course of action for your benefit account based on your financial goals. Retirement should be about freedom, not stressing over the missed opportunities while preparing to leave. After all, timing is everything. By locking down your health checkups, understanding your coverage, and grabbing every last benefit you've earned, you're not just leaving work, you're stepping into the next phase with confidence, clarity, and control. The sooner you take these steps, the smoother and healthier your retirement journey will be. Until next time, sage well.